As a neuro-ophthalmologist, neuro-ophthalmology is a little different than most other areas of ophthalmology in that usually neuro-ophthalmologists who aren't dual trained in pediatric ophthalmology or oculoplastic and
Hmm.
reconstructive surgery or aren't practicing comprehensive ophthalmology, they usually don't operate at all.
Hmm.
How did you decide to go into neuro-ophthalmology, choose that as a subspecialty, and do you miss the OR at all?
Yeah. So I think when I got to residency, I thought I was going to be a retina specialist. There was no question in my mind. I had, as a med student, I'd done basic science research in retina. I went to my residency at the University of Virginia in part because in my lab doing retina, the same research type of research I was doing at Hopkins, Peter Campicero was there as a fellow, and I was a med student. And then he went and took his first job at the University of Virginia. So when I was looking at programs, I either wanted to stay at Hopkins or to continue doing that research or go, I thought, to the University of Virginia because that's where Peter was going. And so I ended up in Virginia. And within about a year or so, I realized, I don't know. It's kind of, clinical retina, you kind of see it, you either recognize it or you don't. And in towards my, the latter part of my med school, I also did a month of neuro-ophthalmology with Dr. Neil Miller, and that was just fascinating, very detective-like. I thought, geez, you could go in the room and walk out with pretty little, equipment and say, I know exactly what's going on and where it's going on in the brain. And we'll get the MRI to verify it, but I know that. So I really liked that about it, and it was very intellectually stimulating. And so somewhere early in my residency, I realized, I think I really like neuro-ophthalmology. And so I had a mentor as a med student, as a resident, Dr. Steve Newman. And then I ended up going back to do a fellowship with Dr. Neil Miller. And I wouldn't do it any differently. So, and I did. I did straight neuro-ophthalmology. I was the first neuro-ophthalmologist at the Storm Eye Center in Charleston. So I never had a neuro-ophthalmologist. So I was kind of like, okay, what do you do? Well, I do temporal biopsies. I do optic nerve sheath fenestrations. That's about it. And so for 3 years when I was there, that's what I did. And then when I moved to Cincinnati, the oculoplastics guys who'd written papers on how to do nerve sheath fenestration said, well, you can still do them if you want, but there's not that many. You're probably not going to get block time. We're happy to be your technician. Just tell us what to do. We'll send you all the patients. And I said, yeah. So I did them a little bit and then realized, there weren't that many. And so I said, all right, I'm not going to do nerve sheath fenestrations. And so then I was just doing temporal biopsies and I didn't have any block time. And after another 3 or 4 years, I said, all right, forget it. Just you guys do the biopsies. And so that was probably around 98, so it was 7, 8 years after I finished training. But yeah, I never, even as a resident, I wasn't like my co-residents lived and died to be in the OR. And I was like, that's okay. But I wasn't, it wasn't really, it definitely obviously wasn't for me. It wasn't something I needed. And so when all was said and done, I was like, oh, good. I don't have to worry about trying to find time to book the case and so on. And I was only doing temporal biopsies when I stopped anyway. So yeah, I love what I do. I wouldn't change it. I wouldn't go back and change it.